Dr. Matt is going to show us how to adjust a child right now. Yeah. And what are you going to be doing to him? What is this benefit?
So basically the benefit is we're going to be checking his joints both in his pelvis and in his spine and seeing how each joint is moving essentially. So basically we're looking for any joint that's not moving as well as it should be or not having the proper range of motion, and we're going to restore that actually. The way we're going to be doing it is actually much gentler than what a lot of people, I think, perceive in their mind that we do with kids. Instead of, I'm not going to be twisting his neck or jumping on him or anything like that, or anything close to that. We're actually just going to be using something extremely gentle where it's just basically called an activator, essentially. So it's basically just a little tap. You can even do it to your index finger. It hardly does anything. We can adjust the strength of it depending on where in the spine we're using it, but it's never very high for kids because you don't need to use much force at all. You definitely don't need to use anything like what we do with an adult, which still isn't as much as a lot of people think.
All right, well, let's watch you do this then.
Okay. Xander, you ready? We're going to get you fixed up here, okay, bud? So we're just checking Xander's spine here to see how everything's moving. And there's one spot actually right here in his lower mid-back that's just a little bit stiff. Is that a little tender, Xander? Or does that feel okay? Feel okay? Good, good. So we're just going to get that moving better for you again. So we're just going to use a little activator that Xander's a pro at this. He's had this before several times, but it's just going to be one little tap here. And that's about it. Pretty easy, right, Xander? Yeah. Feel good? Good. Okay. He's a little shy today. That's okay.
And now for my children, they both had colic, and they both had, like, my daughter was lip, tongue, and cheek tied. So chiropractic was very helpful for both of my kids. Can you explain how chiropractic in infants can help nursing and it can help with colic and reflux?
Absolutely. So in infants, obviously much younger than Xander here, but it can be extremely helpful for, colicky babies. It can help with latching, actually, if they're having any issues in their mid-back or neck, actually. Childbirth can be very traumatic at times, especially more natural childbirths, obviously. That's a traumatic passage there, but we can get that moving pretty easily for them, and children respond extremely fast, much faster than adults do, actually. So it's always a lot of fun treating them because you can almost see instant results sometimes. So it's always something we really, really enjoy doing and try to help whenever we can in those situations.
Do you feel better?
Feel good there? Very good, Xander. Is your neck been bothering you at all? No? Good. Very good. We'll just check that real quick and make sure it all feels good. And good. Excellent. Can you look all the way over your left shoulder for me?
He already knew.
Yeah, he did. He's already got it down. Well, good job, Xander. You did great. Yeah, good high five.
So that's as simple as an adjustment for a kid.
That's it, actually. As simple as that. It's nothing extreme or anything. It's extremely gentle and easy to go.
Well, thank you, Dr. Matt, for your time.
No problem.